Dr. Balaj, at King's College Hospital in the Marina, you are the dermatologist over at the aesthetics branch.
Yes.
How long have you been at King's?
I arrived last year. It's a bit of more than a year with King's. Previously, I was working in Ajman in UAE, and prior moving to the UAE, I was working 15 years in Sweden in private and governmental healthcare as a dermatologist.
Well, King's are very lucky to have you. I got perioral dermatitis, which I've had on and off for a number of years, but you really helped me. It is red and itchy and tends to affect me around my mouth, and you get little spots which you really want to just take the top off, which you're not allowed to do. Why did I get it?
I don't know. We don't really know the exact reason why some people have a tendency to get these lesions. These are small pimples actually. It looks like acne or rosacea, but it's definitely sitting around the mouth. That's how this medical term, perioral, it means around the mouth. So it usually comes around the mouth, sometimes around the eyes. We don't know what is the exact reason, but we know a lot of things which can make it worse.
We'll go through those in a minute. There's a long list of things that you think make it worse, for sure. It comes and goes. It isn't rosacea. A cousin of rosacea?
They are similar diseases, but not exactly the same diseases. And what is the biggest difference? This can disappear, and this can disappear for good. Rosacea is not disappearing. So usually rosacea is a chronic disease. Perioral dermatitis, with a proper treatment and following some proper rules regarding taking care of it, it can disappear forever. What I usually do when I see a patient first with these kind of things, I always ask for the skin routine. It's very important to know what our patients applying on their face. And in this case, you should definitely avoid any heavy or waxy or oily moisturizer, because this just generates more pimples, makes it worse. So that was the first thing, to put those aside. I remember you had
use an oil cleanser.
Yes. And then we try to treat it, and we try to give something which reduces the inflammation in the skin. And it's paradoxically, it's an antibiotic tablet. But these tablets are not only antibiotics, they reduce the inflammation inside the skin. These are very well used even in rosacea or in acne and in perioral dermatitis. But usually for perioral dermatitis, much shorter treatment is enough.
When you say shorter treatment, I think it was 2 months or so.
With rosacea or acne, it's not rare that we give these tablets for patients for 2-3 months altogether.
Right.
In perioral dermatitis, sometimes 4-6 weeks enough.
Okay, but it's a very low dose.
Yeah, it's 300 milligram daily. It's not a huge dose.
Right.
but
for those who are scared of antibiotics, is there any other option? Because some people just don't like antibiotics.
We could go for the topical treatment, but as in your case, you were urgently in need to get a good response. The creams are working, but those are usually, the result is taking way longer time, sometimes 2-3 months.
And I think I did contact you and said, it's not working. Be patient.
Yes, that's something.
And it does work. It did work. I did a post on this when I had it, and a few people thought that you could get it on your body.
No.
No, that would be something else.
Usually this is sitting only on the face.
Generally around the mouth and sometimes
around the
eyes.
mouth, and rare occasions around the eyes, yes.
Right.
Most of the cases females. That's why there's a theory that's connecting this disease to hormones, female hormones. But I do see men with the same issue. Less.
Right, okay, so age-wise would be then, if it's hormones, teenagers and then perimenopause?
Usually we do not see in a teenage older, but kids, for example, can suffer, and then later on, over the 20s, can affect almost everyone.
So it isn't the fact that if you have it, you're going to get it back. Although most
It's
people
not-
say
not-
that
not-
it's kind of.
It's not given. But for
Okay.
example, my wife had the same issue. She was suffering for at least, I don't know, 6 months, and it was just returning to her.
And you weren't helping her.
I was trying, but at the end we found something.
Doctors aren't very good husbands, I find, in the helping way.
Dermatologist, yes, she's always complaining. If you already have the lesions and you keep continue with the oily one, it will just aggravate the
Right.
symptoms.
Right.
If it's gone, usually I recommend some weeks in between
Yeah.
those changes.
Yeah. And then you can go back.
You can go back, but actually it's summer, so it's better to use something more water-based. Because in summer, because of the heat and the sun, your skin is producing much more oil, its own oil, our wax.
Okay. I'm just very quickly going to read through the things that people thought triggered this for them. So we've got thyroid, gut health, dairy, need my glasses, high SPF, AHAs, fluoride toothpaste. That's a biggie.
What is sure from this list is the sunblock, the high sun protective factor, was it?
Yeah,
Yes.
AHAs.
Yes,
And
that sure
high
can
SPF.
can close these pores in the skin. So surely if you have a small amount of these lesions, it can aggravate it very quickly, and it can get very ugly very quickly with that one. The fluoride toothpaste, you found it even in our textbooks, but it's
Really?
not. I usually recommend the patients to stop using it, but there's no real clear connection.
Right. Heat and sun. I've had this in England in the freezing cold as well as in the heat.
The heat, I'm not sure that the heat has anything aggravating it. The sun can aggravate these symptoms if it's already inflammatory.
Roaccutane and coffee and alcohol.
Coffee and alcohol, as it makes rosacea worse, it can make seem these lesions more intense. Roaccutane actually is something we use for treating it. In the most desperate cases, people getting a very low dose Roaccutane, and it works really well. So.
Because it's getting the oil secretion down.
Yes.
Right. Things to fix it. I've got a very quick list of this. Something I can't pronounce. Magnesium supplements. A mask of mayonnaise, Greek yogurt, and honey. Is that a good one?
Mayonnaise definitely not a good idea. That would work as a heavy, greasy moisturizer cream. Would close your skin down, unable to breathe.
These people who have tried this really believe in these things, and then maybe if you believe in it, it's going to work.
I don't know. We don't know the real diagnosis either.
Red light therapy, chamomile tea bags.
Red light therapy, something can reduce the inflammation in the skin, yes. Chamomile is well-known home remedy, anti-inflammatory. Usually it's really good in eczema skin, to be honest.
So people lie around with tea bags all over them.
With tea bags, black
Yeah.
tea bags too.
Okay. Methotrexate.
Methotrexate.
Yes, that's the one.
That's a cytostatic medication. We use it for rheumatoid arthritis, psoriasis. I definitely would not recommend to use in this
Okay.
case.
Azelaic acid.
Azelaic acid, this is something I was recommending to you too, because
Yes.
that was out of stock in Hold Dubai, and
Yes.
since then we have some problem to get it for my patients, but that definitely can work, yes.
Okay. Celery juice and acupuncture.
I don't know nothing about the acupuncture, and celery juice, that's
Yummy.
yummy, but I don't know if it helps in this case.
Right. Okay. Did we tell everybody what does work?
For you, at the end, it was limecycline, so tetralysyl, the medication, and we changed your skincare routine.
Very topic.
Yes, and you got the Protopic because azelaic acid wasn't available.
Right.
And Protopic is an immunomodulatory treatment, and it could be used in this case. Usually has a really good effect.
Right.
Just some few sentences. What is happening during the summer? Sun and heat. So sun affects our skin, heat affects our skin. Heat's effect, our skin, everyone's skin is getting much more oilier
During the summer.
during the summer,
Okay.
and the sun's effect, actually sun is damaging our skin, causing premature aging of our skin and causing even skin cancers in long term. So this is what we should avoid, or we would try to avoid these damages. With this, we should avoid the sun as good as we can. We should use sun protecting factor or covering clothing. It's very important to wear breathable clothes, because
Breathable clothes.
Yes,
Yeah.
breathable clothes. Yes, thanks. And drink a lot, hydrate, and yes, there are good routines, skin routines for the sun. What to apply, when to apply.
When you say drink water, it can be liquid, right? As long as it's not alcohol.
Yes, it can be liquid. Yes,
Yeah.
Alcoholic, and no sugary drinks. Actually, sugary drinks make you more thirstier with times.
Really?
Yes.
Okay, I didn't know that. So hat, sunscreen. What about vitamin D?
Vitamin D is just great. You don't need that much actually. There are the scientific data that being out on the sun 20-30 minutes weekly provides you enough vitamin D. Yes, and you can even take these vitamin D capsules
Instead of going out in the sun.
Instead of I myself, I do go out to the sun, but there's always an option to
Well,
take.
you have no wrinkles, so you must be wearing a hat.
I do wear a hat. Yes.
Right. Do your daughters sunbathe?
Yes, sometimes they're out on the sun, but we use definitely strong, at least 50 factor sun protecting factor.
On their bodies as well as their faces?
Yes, we try to.
Really?
We try, yes.
I get pretty slack closer I get to my toes. The
Oh.
number goes down.
My daughters, they're fair skinned, and I've been treating in Sweden a lot of patients with skin cancer.
Right.
So this is coming through the years.
Right.
It takes time to develop them.
My mother taught me to sunbathe with tin foil.
Yes.
She taught me.
Yes,
Works really well.
it does.
But not for when you get to your 50s when you regret it.
It depends. What are your goals? So the UV gives you pigmentation. You can get these brown patches. Your wrinkles are going to be deeper, just being out on the sun.
Yeah.
So if you want to avoid it, best way is the prevention.
Yeah. So sunbathe, hat, skin sun protection, 100 or 50?
50 over 50. That's
Or 100.
actually if you go to the American Academy of Dermatologists homepage, they recommend everything over 30. But on the face, so the area where we do have the most aging is the face, this cleavage area, and the back of our hands. So if somebody is applying a strong sunscreen on these areas, the aging will be much less visible.
Never
aging.
put sunscreen on my hands.
Mhm.
I felt really bad, and I'm never going to show my hands to you. Right. Well, I think that's sorted. Is there anything else we have to worry about in the sun?
That's it. These are the effects, and just to protect yourself, you can apply moisturizer creams. You can apply serums. Vitamin C is very good, just to protect you from these damages what the sun causes, and hydrate yourself, even topically. The moisturizer cream, hyaluronic acid serums, these are very good ones.
If you're using any of those things that are maybe drying, Roaccutane or is that worse going in the sun?
Roaccutane gives you a very strong sun sensitivity. So all the patients who are taking it, we are going through with them to use very strong sun protection. And yes, they are not really allowed to go out on the sun to sunbathe.
Right. There was also one antibiotic that you told me that.
Yes,
causes sunburn.
and those are also used for acne or these diseases. It's called doxycycline. I've seen quite bad reactions onto that, and it is used even for lung infections.
Right. Okay. So watch what you're using medication-wise also if you're going in the sun. Okay, well, I hope that answers your questions on perioral dermatitis. Please ask me more and I will try and get the answers. But whatever works for you, stick with it. But thank you, Dr. Balazs, for fixing me.